previously worked at Apollo Hospital, Ahmedabad, and has experience of 21 years in this field. Sir has completed MBBS, MD General Medicine, as well as DM Nephrology from Gujarat University, India. He is a professional member of Transplantation Society, American Society of Transplantation, Indian Society of Organ Transplantation, Association of Physicians of India, and the Indian Medical Association. Sir, expertise in diabetes nephropathy. Sir, we are honored to hear your talk. Over to you, sir.
Hello everyone, I am Arushi Gumbar. My father will be joining in 10 minutes.
Okay, sure, ma'am.
Okay, thank you.
Ma'am, please do the full screen of your slide.
Yeah, sure.
Okay.
स्लाइड तो पता चलेगा।
A very good evening, sir.
Yeah, good evening. Am I audible?
Yes, sir. Perfectly.
Are my slides visible?
Right now it is not, but
Screen is not visible.
first is COVID-19, sir.
19 years.
Yes, yes.
Next
It is
is
visible. Yes, sir. It is visible.
just a minute. I'm just adjusting my slides. Okay.
Okay,
Wait.
sure, sure, sir.
Okay, okay.
और नहीं हो पॉसिबल
Zoom
नहीं
नहीं है।
Is it visible now? Are the slides visible?
Yes, yes, sir. It is visible.
Are they changing?
Yes, sir. They are changing.
Okay. Okay. Then I'll start. Okay.
Okay, sir.
Should I start?
Yes, sir. Let me introduce to our student. Shall I start, sir?
Yeah.
A very good evening to one and all. I, Dr. Akanksha, on behalf of Gujarat Council of Science and Technology, welcome Dr. Manoj Kumbar. He is a nephrologist, renal specialist, currently worked as consultant at Government Civil Hospital and IIM Ahmedabad. Sir has previously worked at Apollo Hospital, Ahmedabad, and has experience of 21 years in this field. Sir has completed MBBS, MD General Medicine, as well as DM Nephrology from Gujarat University. He is a professional member of Transplantation Society, American Society of Transplantation, Indian Society of Organ Transplantation, the Association of Physicians of India, and the IMA, Indian Medical Association. Sir's expertise is in diabetes nephropathy. Sir, we are honored to hear your talk. Over to you, sir.
Yeah. Good evening, students. Today is 16th February 2022, and we are still discussing COVID-19. That itself suggests that we are still in the middle of epidemic. We all know that we are in the third wave of COVID-19. Second wave was Delta variant, and this time it is Omicron variant. Now, this virus is constantly changing, and new variants of the virus are still expected. Some new variants emerge and disappear, other they persist. At present, lot many variants are being tracked in US and globally during this pandemic. This virus and the variants are like a tree and the branching out. Each branch on the tree is slightly different from the other. By comparing these branches, scientists label them according to the differences. These small differences have been studied and identified since the beginning of the pandemic. Some variations, they spread very easily and they are resistant to treatments. The, the variants which spread easily and are resistant to treatment must be monitored carefully. By studying each variant and understanding these differences, scientists can monitor, predict whether a variant is more dangerous than the previous one or it is mild as compared to others. वो बोल दूं वो शेयर करेंगे. Dr. Akanksha, I'm having some problem in changing the slides. Maybe you are having the slides, okay? Maybe you can start sharing from your side, okay? Dr. Akanksha?
So let me share.
Yeah, because I'm having some problems in sharing the slides.
Okay, sir, let me share.
Yeah.
Uh, so
Are
your
the
PPT
slides
is
visible?
yes, sir, they are visible. Yes, sir.
Actually, they are visible, but the problem is that I'm not able to change them actually. Problem is that.
Okay, sir. First, you have to stop sharing, then I can
Okay,
share
I'll
my
stop
slide.
sharing. Okay, yeah, stop
Okay, sir.
sharing. Are they changing now?
Uh, yes, sir, they are changing.
Changing. Okay, let me start.
Yes.
If it is a problem, I'll tell you. Okay.
Okay, sure, sir. I'm here.
Sorry for the disturbance. Now, we all know actually before the January 2022, we were all happy that the COVID has gone and it may or may not come again, the third wave. Whether India is going to have the third wave or not, we were all in a doubt. But yes, the moment the January started, the 2022 started, almost like 50 countries were affected, and India was among these and was heavily infected. But fortunately, this time the peak was sudden and the downfall was also sudden. And uh, you must have seen the newspapers today that practically the whole of Gujarat doesn't have more than 500 cases today. Okay, so it was very sudden peak, and the fall was also as quick as the peak. Now, there is a difference between the Delta wave and the Omicron wave in terms of symptoms. There is no breathing difficulty. There is no loss of change or loss of smell or taste in this. But in this, people had fever with chills, high temperature, dry cough, scratchy throat, headache, and high pulse rate. These were the symptoms which were not there previously. The chills was not there, the high temperature was not there, even the sore throat was not there. So there is a little bit of difference in even the symptoms between the Delta and the Omicron. But good thing is that it's a mild variant as compared to the Delta variant. The lungs are not getting affected, or they are getting affected, but to a less number of patients. Now, usually these patients who are getting affected by Omicron are asymptomatic or having mild infection, and practically there is no need for any investigations or even treatment. Just like to bring the temperature down, you should be having a paracetamol. You can take vitamin C tablet. One multivitamin is required. Only if the high grade fever does not resolve after 3 days, there is a difficulty in breathing, there is a dip in oxygen saturation less than 93%. There is a persistent pain or pressure in the chest. There is a mental confusion. If severe myalgia is there, then only you need to seek medical attention. Otherwise, just home isolation is enough to cure this variant. Now, what to do when you are exposed to someone with COVID? Wear a mask around others for 10 days. Test on day 5 if you are asymptomatic, and if you really want to know whether you are suffering from COVID or not, get an RT-PCR done. Obviously, if you develop symptoms, then you are supposed to have undergo the testing RT-PCR, but at the same time, you are supposed to stay home now. When to discontinue home isolation? In Omicron variant, there is no need for 14 days of isolation. 7 days is good enough. And after 7 days, there is no need to repeat the um, COVID RT-PCR. You should be using a mask for the next 3 days, and after 10 days, practically you are free to move around with the mask. I'm not going into the details of the treatment. Now, talking about COVID symptoms in children, practically they are same as those with adults, but there is a fever, there is a sore throat, diarrhea may be there, cough is there, body ache, headache, nausea, vomiting can be there. Common cold was previously not there in Delta variant, but Omicron variant, Delta wave, the Omicron variant, rhinorrhea is there. Weakness, yes, severe weakness patients are complaining of, and there is no loss of taste and smell in this variant. As I said, there are no investigations to be done other than COVID RT-PCR. Only investigations are required if there is a persistent fever for more than 3 days. Otherwise, no blood test to be done, no CBC, no CRP, no D-dimers, no LDH, no ferritin levels are supposed to be done in this variant. Now, what are the precautions for the school children while going to school in these days? Ideally, yes, online should be the mode of teaching right now. But obviously, now the Omicron wave is on in a downtrend. The schools are going to reopen. So we should know and we should educate the kids about hand hygiene, respiratory hygiene, importance of taking precautions and instructions, especially social distancing and wearing mask. Patient Parents should follow all the precautions to make the kids follow them. Instruct not to share snacks in the school with friends. Provide them tissue papers. Do not give sanitizer bottle to kids less than 10 years of age. Bus seat number should be given to the each student so that he occupies that particular seat only. No extracurricular activities should be there. No sports period should be there. Water should be taken from personal bottle only. CCTV cameras to be installed in all classrooms in and around the school so that the kids can be monitored. Okay, so they are maintaining the social distancing. They are wearing masks. Mask etiquette should be taught to all the students so that they do not spread to other students and their back home their parents. It is better that we use exhaust fans in the classrooms. We open the windows and use fans. Cleaning and disinfection protocol to be strictly followed by the school authorities. Bathrooms too to be specifically taken care of. Preferably an alternate days school to start with. Fixed sitting arrangements should be done in the school. Do's and don'ts and hand hygiene posters should be applied in all classrooms. There should be no breaks in the school. Reduce the duration of school hours. Reduce the strength of the class. Educative sessions to be taken for and by teachers. Preferably install mic system in the class so that our teachers don't have to shout and they can maintain social distancing from the children. Now I'll summarize, okay, what to do when you become symptomatic or you are COVID positive RT-PCR. First of all, do not panic. If you do not know anything about Omicron, call 104. The government facility is there. Government doctors will instruct you what to do. They will decide whether you need hospitalization or home care. 99% of the patients require home care only during Omicron infection. Inform your company's tool or your school, your institute that you are COVID positive. Make a list of people whom you met in the last 3 days. Inform them so that they can take precautions, they can isolate themselves, and if required, they can get their COVID RT-PCR done. Do not worry, stay positive, maintain hydration, strict hygiene and strict isolation to be followed so that you do not spread your infection to others. Make a cleaning list and schedule when you are in home isolation. Watch for symptoms that require medical attention. We are all facing the most difficult phase of our life in these recent times. Nothing lasts forever, and same will be the for the COVID-19 pandemic too. All limitations are self-imposed and for self-protection only. If we cannot stay at home with family, imagine how the armed forces stay in extreme climatic conditions and risking their life for us. It is for us only that we have to isolate ourselves at home. So it is for our benefit, our family members' benefit, and for the society benefit that if you are caught with Omicron, please stay at home. Obviously, when the body is healthy, the mind and the heart are open to positive aspects of life and develop abilities to face realities boldly with a smile. Now, you should know the factors which decide the outcome of COVID infection. Age more than 60 years, yes, they can develop complications. If the patient is having diabetes, hypertension, or is having some heart problem, chronic kidney disease, yes, these are the patients who are prone to develop complications. So these are the patients who should be monitored very carefully. Very, very important uh, aspect of one of the things that should be kept in mind, and when one of the things we should maintain is mental health. How to do it? Most important is that you sleep for 7 to 8 hours, eat balanced diet, take adequate amount of fluids, water, juices, stay in touch with others, thank God and meditate, have patience, stay positive, enjoy music, watch movies, read books, stay away from COVID media which gives unnecessary information. Only authorized information from the government should be taken into consideration. All the forwarded messages should not be taken into consideration. These forwarded messages unnecessarily will increase your tension and stress in life. Now, the general instructions to prevent coronavirus infection and spread is use mask, hand hygiene with either soap or alcohol, 70% alcohol solution thing. Avoid touching face, eyes, and mouth, not to shake hands with others, maintain social distance of 2 meters, avoid coming in contact with people with respiratory symptoms, follow cough and sneeze etiquettes. Why home quarantine? It is one of the most cost-effective public health intervention to break the chain of transmission. Self-quarantine for 7 days. That is very, very important. And the aim of home management is just to prevent transmission to others and monitoring of symptoms, any symptoms which should prompt hospitalization. What you should do at home quarantine if you are having Omicron is just twice daily temperature checks, make a chart of your symptoms, grade them 1 to 10, and day by day, are these grades getting better or not? You just see. Monitor for difficulty in breathing. Monitor the cleaning chart with day, time, and frequency and item. No repeat test of RT-PCR required to document recovery during or at the end of the home quarantine period. Now, you all must have heard about the new normal. What is this new normal? New normal is just follow hand hygiene, cough etiquettes, avoid going out unnecessarily, wear mask, continue social distancing, eat balanced diet, avoid outside food, make a list of The things which you are going to shop online, online payment, you exercise, meditate, stay positive, clean the house with appropriately, take care of elderly and at high risk persons who are diabetic, hypertensive, or having chronic kidney disease. Watch for symptoms and be intellectually honest. I mean, intellectually honest means if you have symptoms, you isolate yourself. Get your test, COVID RT-PCR test done so that you do not spread infection to others. Now, Dr. Akanksha, I have prepared some slides on behalf of the students only. That what are the common questions which students or people ask
Uh,
about COVID? Okay,
oh, okay, sir.
maybe I'll just continue and the end of the things. Maybe uh, I'll ask the students also what they have understood from this. Now,
Okay, sir.
most of the what are the most common symptoms of COVID actually? Okay, one thing is fever, second is cough, and now it is headache, body ache. These are the most common symptoms of COVID infection. What are the basic precautions to prevent spread of coronavirus? First is use of mask. Second is maintaining social distancing of 2 meters. These are the two most important things. But obviously, hand hygiene, avoiding touching face, eyes, and mouth, not to shake hands, avoid coming in contact with people with respiratory symptoms. Following cough and sneeze etiquettes are the basic precautions to prevent spread of corona infection. Now, lot many masks are available in the market. N95 surgical mask are available. Which mask you should wear? It depends upon your profession. Obviously, if you are in a medical profession, you are supposed to wear either surgical mask or an N95 mask. If you are visiting a hospital, yes, minimum triple layer mask should be there. Homemade mask at home, you can use it, no issues. If some person at home is affected with COVID, use triple layer mask. Important thing is that if you are using a surgical mask, you have to change it every 8 hours of usage. And if it gets moist or if it gets wet, you should change your surgical mask. N95 mask too can be reused with the proper technique. Now, next is obviously everybody is very keen to ask how many days or months we are supposed to live like this and take all the precautions, maybe for 1 month or for another 6 months or 1 year. Yes, we have to take precautions. This COVID-19 is definitely going to end, but just take precautions for another 6 months or 1 year. Next is how frequently hand sanitization has to be done. At least after coughing and sneezing, before and after eating, drinking, and using the washroom. Wash hands often with soap and water for at least 40 seconds for COVID patients, otherwise 20 seconds is good enough. While using hand sanitizers, 20 seconds are good enough. Which sanitizer to use and how to know whether it is of original and not fake. Anyone with a 70% alcohol is good enough. Rub on your hands. You should feel some coolness in your hand with a good quality one. In case of good quality one, your hand should get dry early within 20 seconds. A typical pungent odor should come with the use, and a perfume sanitizer is usually not good enough. Now, I'm a high risk patient, I'm a diabetic patient, having chronic kidney patients. Can I join work after my COVID affection or not? Yes, but taking all precautions. The precautions are obviously using mask, maintaining social distancing, respiratory hygiene, carrying a bottle of hand sanitizer, and if you have to interact with people with public within 2 meters of distance, use face shields. If there is a history of contact with COVID patient, what should I do? You should know whether the contact is of less than 20 minutes or more. Where you were at the time of contact, were you wearing a mask at that time? Was the infected person wearing a mask? What was the distance between you and him at that time? And if you are still in a doubt, contact your doctor, take guidance regarding the need of quarantine and getting a COVID RT-PCR test. What to do if the symptoms start of COVID? Do not rush to the lab to get tested. Do not panic. Call your doctor, get an RT-PCR test done home facilities available, ask the lab to come to your house, get it done. Till the results come, strict isolation. And if there is a difficulty in breathing, please go to the hospital and take medical attention. Next is, what is the importance of vaccination when so many new strains are emerging? Vaccination does help in reducing the intensity of infection. This time, maybe the Omicron is mild or all of us are vaccinated. That is the reason we are all having mild infections. So please go ahead with vaccination as per schedule. How to visit a doctor during corona times? Ideally, online consultation should be there, but spend minimum time in the hospital or clinic, wear a mask in face-to-face consultation, and maintain social distancing. What to eat to increase immunity? Ideally, whatever your grandparents used to eat, homemade cooked food, yes, that is the way to increase your immunity. And other ways to increase your immunity is sleep for 8 hours, eat balanced diet, maintain hydration, stay in touch with others, have patience, stay positive, do what you enjoy and do a job which you enjoy that will give you peace of mind. Stay away from COVID media. What care should be taken when taking aged people and kids to the hospital? First of all, avoid taking them unnecessarily to the hospital. Do not miss routine vaccination for kids during this COVID-19 epidemic. For kids less than 2 years, do not use mask. For aged people, use wheelchairs after sterilizing the handles, and a family member should be the driver of the wheelchair. Soap or sanitizer, which is better? According to me, soap is better. There is no chances of side effects. It is reliable and can be used with soiled hands too. And most important, it can be used for all ages. What are the exercises and yoga to prevent COVID? Neither exercises nor yoga prevent COVID. They both are good for your health and overall well-being. You
Sir,
should
are
do
you
it and
there?
continue doing that. Yeah? Hello? Hello?
Yes.
Your voice is breaking, madam. Am I audible? Am I audible? Dr. Akanksha, are you there? I do not know what has happened. नहीं है अभी तो slides आवाज ही नहीं आ रही ना बेटा. Good evening, Dr. Akanksha. Am I not audible? Okay, so what am I supposed to do? Just wait? Okay, you just let me know, okay, when to start. Sure. Okay, no problems. You can give me a call if I'm not audible on Webex, okay? अभी just error आई है. Hmm. Hmm.
Sir, you can start.
Okay. Am I audible now?
Yeah.
Okay. Next question is, what can you advise to people who use mask only to cover the mouth? Mask is to cover both nose and mouth. Only covering mouth is of little use or value. Next question is, how do we change our perception about COVID-19? Most important thing is we need to educate ourselves and know what to do and what not to do during this COVID pandemic. If you approach it correctly, the fear will be less. At the same time, some fear is in fact appropriate to remind us to take precautions. Do not rely on forwarded messages. Continue taking precautions. And most important thing is, if the parents follow all these precautions, kids will definitely follow. Again, I'll tell you, being intellectually honest is very important in this pandemic. That is the key to fight against the virus. I again remind, what is being intellectually honest during this COVID pandemic is that if you have symptoms, you isolate yourself. Do not go outside your house and spread to others. If you think you are COVID positive, get your COVID test positive, and if it is negative, then only you go outside. Otherwise, remain isolated. As per guidelines, remain isolated for 7 days. You can come out of the isolation after 7 days with use of mask. Now, people say that everybody is going to get affected by this COVID-19 sooner or later. Now, why to postpone your exposure to corona? The virulence of the virus is decreasing. We know that Delta variant was much more virulent as compared to Omicron. As the epidemic or pandemic progresses, more and more days pass on, weeks pass on, months pass on, the virulence of the organism, the virus is going to decrease. And hopefully, only asymptomatic infections, just like a routine common cold, will be there in future. So it is better to postpone your exposure to corona. Now, can everyone contribute in this epidemic? Yes. What can be done? What should be done by everyone and everybody? Take all preventive and precautionary measures. Avoid spreading unauthentic information. Avoid going out of the house unnecessarily. Respect corona warriors and stay positive. Now, we are all fighting against corona. Who is going to win? Virus or you? The only thing which decides is your alertness level. Now, with a fresh mind, you are 100% alert. The virus is 100% active and alert, but you will win because you are 100% alert. If you develop a casual attitude, that means you are less active, you take precautions partially, then the virus is 100% active. Virus may win. At the same time, if you develop, if you are, if you're getting lazy in wearing a mask, maintaining social distancing, you do not bother about all the routine precautions, then virus may win. But if you remain alert, keep in mind, you will win. You are not going to suffer from COVID-19. Now let me check the students, are they listening or not? Or should I proceed? I think I should proceed with the next slide. Now, the most important thing in COVID-19 is that all the kids are not allowed to go out, play in the grounds, or not allowed to even go to the school. Then what should be done at home? How to improve your mental health? The keys are sleep hygiene. Go to bed in a good mood and sleep for 7 to 8 hours. Do your duties as if there is no choice not doing it. Eat balanced diet. Exercise. Remind you, I am reminding you that exercise is the most powerful antidepressant. The formula is whatever you do, you can do it in 23 hours. The rest 1 hour you give for exercise. Dress well and stay in touch with others. Have patience. COVID-19 is going to go definitely. Next is what gives you peace of mind. Maybe you are too young to define peace of mind, but still, let me tell you that staying healthy is very, very important. And thanking God for whatever we are in the current situation. Still, thank God. It could have been much worse. We are still better. Every human being, every kid is born for a purpose. Work on it gradually and continuously. Help others and think of others come first, you will feel better. Whenever you are having problems, make a problem list and a solution list. You will feel better. The solutions you will get of all the problems, maybe lot many problems are actually not problems, you are just thinking about them. Next is how to be happy. First is learn to seek and give blessings. Obviously, you are all too young to give blessings, but learn to seek blessings. Help others in whatever you can. Stay healthy. Play sports. If you become a sportsman, nothing like it. Else, sports will make you a better human being, a fighter, a competitor, and you will know the importance of teamwork. Every child is born for a purpose. Work on it gradually and continuously. How to be successful in life. Plan your each day. Learn to express yourself. Give your best. Do things that make your parents proud. Not to be part of a rat race. Just be different. Do read the success stories, but do at the same time, do read the failure stories too. Because failure stories will guide you better towards not to make mistakes in life. Know your weakness and strength in life. Keep working on both. Do not postpone difficult decisions. Take them. Now, I'll thank all the Corona warriors who are day in and day out working for the patient's well being, and to every person who is protecting himself or herself and others by taking precautions. Thank you. Stay safe, stay healthy, stay strong. If any student has any questions regarding COVID, they can very well
Yes,
ask me.
sir.
No issues.
How does booster dose helps in preventing or recovering from corona COVID situation?
First of all the booster dose will never help in recovering from corona.
Okay,
Boosters dose will prevent you from COVID,
okay,
and if not prevent from COVID, they will definitely reduce the intensity of infection. So, whatever the government has made a schedule,
yes,
whenever the government is giving the booster doses, please take it.
okay. And one more question. That is why double vaccinated people are getting diamonds. वो क्यों मर रहे हैं? एक स्टूडेंट ने ऐसा क्वेश्चन पूछा है.
देखो, all the patients who are getting admitted in the hospital, they are having some form of comorbidities. Comorbidities means their age is more. Either they are diabetic, hypertensive, they are suffering from heart disease already, or they are having cancer, or they are having chronic kidney disease. So, a healthy person gets affected by COVID, especially with this Omicron variant, will not land up in ICU. The message is that you have to not let these comorbidities enter into your body. The only way that these comorbidities can be kept away from you is doing exercising, doing good amount of exercises, walking, maintaining optimal body weight, and eating balanced diet. This COVID-19 has given us one aspect is very clear that if you are eat well, if you do exercise, and if you do not let these comorbidities enter into your body, no virus, no variant of the virus is going to affect you. Obviously, if you remain healthy, take these booster doses, all these viruses variants will just affect you like common cold and they will go away without having any symptoms, hopefully.
Thank you for such an interactive session. Thank you, sir, for giving a keynote for a success to our child scientists. Thank you so much, sir. Sir, should we end the session?
Yeah, definitely.
Thank you, sir. Thank you a lot.
Okay, bye bye. See you.
Thank you, sir.